So this is the part 2 video of the tumor of bone. We have dealt till miscellaneous bone tumor, but we will deal a little more about cartilage forming tumor, that were osteochondroma, chondroma and chondrosarcoma. So osteochondroma can be said that it is an overgrowth of cartilage and bone that happens at the end of the bone near the growth plate. Most often it affects the long bones in the legs, pelvis, etc. It is common non-cancerous bone growth. That means osteochondroma is a benign tumor type, as we can see written here. It mostly affects the long bone in the legs and also in pelvis. So long bone in the legs is femur, so it can affect femur and also in the pelvis. Next one is chondroma. These are benign tumor composed of mature hyaline cartilage. It is a benign cartilaginous tumor. That means it occurs in cartilage of the bone, and it is a benign cartilaginous tumor and a very rare type. It is a very rare type of tumor, usually grows slowly and develop in sinuses and the bone of the skull. And next one is chondrosarcoma. It is a cancer composed of cells derived from transformed cells that produce cartilage. It is a member of category of tumor of bone and soft tissues known as sarcoma. That means it is a malignant type of tumor. It is more dangerous and it can spread to adjacent structure and can affect other organs too and other bone, causing further damage or severe damage of the bone, and can also lead to developmental delay. So this is the most severe type of tumor because it is malignant and it can also metastasize. Now etiology. Few possible causes are genetics, second radiation treatment and injuries to the bone. Osteosarcoma has been linked to radiation treatment and anti-cancer drug, especially in children. The tumor often occur when the parts of the body are growing rapidly. Last one, these people who have bone fracture repaired with metal implants are more likely to develop osteosarcoma. So children, when they are getting a lot of radiation treatment and other anti-cancer drugs, they are affected with bone cancer due to this anti-cancer drug or more of radiation treatment. Staging of bone tumor. Benign tumor, Anakin staging of benign tumor. Stage 1 is latent, stage 2 is active, and stage 3 is aggressive. That means when aggressive stage, that can be said as when the benign tumor is converted into the malignant tumor. When the tumor arises from the primary bone tumor, that will come into the aggressive stage, and from that stage the tumor will be converted into the malignant tumor. So malignant staging is AJCC, that is American Joint Committee on Cancer Staging System, and second is TNM, that is tumor, lymph nodes and metastasis staging. Third is Musculoskeletal Tumor Society staging system, Anakin, that is according to Anakin, and fourth is surgical staging. And also we will see that benign tumor are classified using Arabic numerals, that is 1, 2, 3 in this pattern, and malignant tumor is classified using numerals, that is 1, 2, 3 in another this pattern. Signs of the tumor. A tumor when looking at an X-ray of another problem such as pain, that means it can be confused with another condition that can be known as pain. Symptoms may include pain that is in the area of the tumor, is dull or achy, may get worse with the activity, wakes you at night. Trauma does not cause a bone tumor, but a bone that is weakened by tumor may break more easily, which can cause severe pain. These are the signs of bone tumor. Moving down next to symptoms. Symptoms can be fever, night sweat, swelling around the bone, limping. Note: if you have a bone tumor, you may need blood and imaging tests such as X-ray. To confirm a diagnosis, the doctor may remove body tissue with a needle or through a cut from suspected area and have it examined under a microscope or signs of tumor, cancer. This is called biopsy. So looking at the symptoms, we just can't say that a person is affected with cancer. For confirming the case that a person is affected from cancer, either we have to do a blood test or an imagining study, and also we can do a tissue culture that is known as biopsy. Radio imaging test. So these include our plain radiography, CT scan, MRI, radionuclide scanning, and PET scanning. So the new term we got here is PET scanning, that is positron emission tomography. It is a scan or an imaging test that allows doctor to scan or check for diseases in your body. It usually uses a mildly radioactive drug to show up areas of your body where cells are more active than normal, especially cancer. That means a PET scan recognizes a more active cell than normal. And it also uses a dye or a radioactive dye or drug. Radiography. Information needed by radiography includes site of lesion, borders of the lesion, type of bone destruction, periosteal reaction. Periosteal reaction means that shows formation of new bone in response to injury or other stimuli of the periosteum surrounding bone. And matrix of the lesion, that means helps to identify in between chondroid and sarcomas and different type of cancers. Nature and extent of the soft tissue involved. Treatment. Benign tumor are watched and may be treated with medication. So medication involves our biphosphate drug, dose once in a week, strontium 89 dose once in 3 months. Surgery. Limb salvage surgery removes the part of the bone with cancer. Nearby muscle, tendons and other tissue are not removed. A metallic implant replaces the portion of the bone that was removed. That means in limb salvage surgery we will remove the affected bone and the nearby structure like muscle, tendons will not be removed as it is a benign tumor surgery. Amputation may be done if tumor is large or extends to nerve and blood vessel. Amputation is done only in the case if the tumor metastasizes or is a malignant kind of tumor. Radiation therapy kills cancer cells and shrinks tumor with high doses X-ray. It is used in combination with surgery and may be used before or after surgery. Chemotherapy kills tumor with cancer drug. It may be given before surgery, after surgery, or for metastatic diseases. Complications of chemotherapy include nausea and vomiting caused by intestinal problem, loss of hair. This is the most commonest type of complication that a person gets when he is under chemotherapy. Anemia or low blood count, infection, loss of appetite and weight loss, soreness of mouth, gums and throat. Other complication that occurs when a person is getting treatment for tumor are bone loss, bone pain, hypercalcemia, osteomyelitis and metastasis. Thank you for listening to my presentation very patiently. I hope you all understood about the tumors of the bone and you will be able to answer all the questions related to the tumors of the bone. Study properly, use this time wisely, stay at home, stay safe. Thank you.